Here are some tips to care for ear infection. Tip 1. Use a warm compress. Apply a soft, warm towel to your child's affected ear. The towel can be moistened with warm water. Make sure it is not too hot. Tip 2. Elevate the head. Keeping your child's head slightly elevated with a soft pillow or blanket can ease some of the pressure during nap and bedtime. This is only suitable for children over the age of 2 years old. For babies, place them snugly to nap in a car seat to keep head elevated safely. Tip 3. Drink plenty of fluids. The act of drinking and swallowing will often open the eustachian tube up, allowing fluid accumulation to drain from the middle ear, and providing some relief from a middle ear infection. Tip 4. Chewing gum. Older children can be given a piece of sugarless gum to chew while supervised. Again, the act of chewing and moving the jaw muscles will often open swollen eustachian tubes enough for some fluid and infection to escape from the middle ear. Tip 5. Refrain from prone bottle feeding. Bottle-fed babies are more likely to suffer more pain with ear infections if they feed and fall asleep lying down. This prone position can cause milk to drain through the eustachian tube and into the middle ear, where it places further pressure on the eardrum or worsens the bacterial infection. Tip 6. Ear drops. If your child is suffering an ear infection with no visible discharge, ear drops may help soothe the pain and pressure. Apply a few drops of olive oil gently into the affected ear using the clean dropper and wipe away any excess using a clean cotton swab. Tip 7. Remove pacifier. While the act of chewing can sometimes free up pressure in the middle ear, the act of sucking on a pacifier can cause fluid accumulation through the nose and throat into the mid-ear. If the pacifier contains bacteria that may also travel with fluids to the mid-ear and cause a severe infection. Tip 8. Heat remedy. When you have a swollen ear and you suffer from a lot of pain, you should use a heat pad or hot water pad in order to care for your infection. When you place a hot water pad on your infected ear, you tend to provide relief to the pain, and this puts the ear swelling at ease. Use a heating pad especially when you are suffering from swollen ears. Tip 9. Do not use earphones. When you experience excessive ear pain, you should avoid earphones. When using earphones, the sounds coming in are high decibels and this could cause a lot of harm to your eardrums. If you want to care for your ear infection, then you should prevent it from any further damage by avoid loud sounds so close to your ears. Tip 10. Avoid stress. Ear pain and a bit of temperature requires you to stop taking more stress. You must not go out in the winds and avoid frequent ear contact with water. The swelling and pain which you experience could reduce in a day or two if you can allow your ears to be stress-free. Any burden undertaken could increase the ear infection and all your ornaments should be removed during such a time. Tip 11. Medication. You are advised to visit a doctor and take expert help during such times. Doctors prescribe ear drops and oral medications for ear pain that is caused internally, and can also give you helpful tips regarding the same. If in case the infection is external, then doctors will give you ointments that would help you. Tip 12. Garlic. Garlic has antimicrobial properties and natural pain-relieving qualities, making it highly effective in the treatment of ear infections. Tip 13. Basil. You can also use holy basil to treat minor earache and ear infections. It can relieve ear pain as well as reduce infection. Click the link below or follow this link https://askthenurseexpert.com/categories/ear-infections for some tips to care for ear infection.